Welcome back to the Aslan Health Podcast. I'm Dr. Mike Hauman. This is part 2 in our 3-part series on red light therapy. In the previous episode, we revealed important details about red light therapy, how photobiomodulation works, and discussed where the evidence and indications are strongest for safe use at home. We separated legitimate science from exaggerated marketing. Today, we reset our thinking, learning how to approach red light therapy for home use with wisdom, accuracy, and prudence. Because the real question I'm asked is this: how do I use red light wisely without hurting myself or wasting my money? Great question. Let's begin with a simple principle. Just because a device emits red light does not mean it's effective, and just because a product is expensive does not mean that it's good or a wise purchase. Some of you have already learned that lesson the hard way on Temu or in the Walmart supplement aisle, for example. The label is shiny, the promise is dramatic, the testimonial is emotional, and the product itself is a glorified disappointment. So, if you don't want to expose yourself to the risk of a red light racketeer, listen in as I shed some light on the practical ways to implement red light therapy into your wellness routine. Come on, let's glow.
Welcome to the Aslan Health Podcast, where science meets soul. Your host for this program is Dr. Mike Hauman, an experienced physician, a certified functional medicine provider, a certified insight coach practitioner, and a devoted follower of Jesus Christ. If you're tired of feeling stressed out, exhausted, overwhelmed, or stuck in survival mode, you're in the right place. So take a deep breath. Let's be transformed by the renewing of our minds. Here's Dr. Mike.
As you can imagine, the market for red light devices is getting more crowded and getting much louder each day. Our first wise reset principle is this: choose your goal before you choose your gadget. Please do not start with, well, I'll just buy a small little handheld wand to see if I like it. Start instead with, what is my goal and what do I want to treat? Because the goal determines the device category. If your primary goal is facial skin rejuvenation, acne support, or a more targeted cosmetic use, that often points towards a mask or a smaller device built for the face. If you don't want to unnecessarily expose your eyes, and it needs to be practical enough that you can actually use the device. So if your goal is androgenic hair loss, you may want to consider a cap or a helmet, or if the loss is localized, a smaller device just designed for the scalp. If your goal is treating a painful knee, a sore shoulder, or chronic neck pain, that may point toward a targeted anatomic wrap, a pad, or a light panel that can be used at the appropriate distance and angle. If your goal is to recover larger muscle groups after exercise, a large panel with greater power to penetrate the deeper tissue would make more sense. My point is, do not buy a device for the aesthetic appeal, buy it for the treatment goal and the tissue application. The second reset principle focuses on device selection, matching it with your treatment goal. In a question, what specifications or device details actually matter when selecting a therapeutic device for home use? Well, these are my top 6. Wavelength, which is measured in nanometers, look in the 600 range, 650 for skin, and 800s or so for deep tissue. Next, power output. Enough output is required to reach deeper tissue targets. Treatment distance. The device design will determine whether it needs to be on or away from your skin. Treatment duration. Well, this is important, for example, if you do not want to hold a wand over several different areas on your scalp for hours during each treatment because your device is too small. And finally, safety. I advise only reputable companies with documented research and a good business history. Again, for superficial treatment like skin and scalp applications, red wavelengths around the mid-600s are commonly used. For deeper targets like muscles and joints, near infrared wavelengths, often in the 800s, are commonly used and necessary. Some devices combine both, which is a feature that you can look for. That will usefully expand the treatment repertoire of the device, but it doesn't automatically make it superior for every purpose. As you look at devices, be aware of the difference between red LED lights and laser devices. For home use, LED-based are often more practical, more comfortable, and in many settings, a safer choice. They tend to provide a less concentrated light field. Laser-based systems can be useful in clinical contexts, but they deserve greater respect, greater caution, and especially greater attention to eye safety. That is not theoretical. Recently, there's been a growing concern around certain red light eye devices, particularly laser-based systems that are used near the eye. Safety evaluation matters here in a major way, so let me say this plainly. Do not improvise with eye applications. Do not look into your red light devices if you own one or use one. Do not assume, it's just light. And never allow a child to use a red light device because someone on the internet said that it's low-level light and therefore harmless. Treat it like direct sunlight. Do not stare at it. That brings us to another important buying concept. When a home device is FDA cleared for a particular use, that does not mean that the government has declared it perfectly safe. It does mean that the device has gone through a formal regulatory pathway for a specific intended use and has some documented basis for safety. That is important. So please, do not consider mystery hardware from an unknown foreign seller with suspicious reviews and a name that sounds like a Wi-Fi password. When shopping, look for transparent specifications, a verifiable FDA clearance when applicable, real customer support, a warranty, and clear instructions. If a device manufacturer does not clearly tell you what wavelengths it uses, how it should be used, and what it is intended for, and then provide clear, easy-to-understand safety instructions, my friend, kindly move along. And when it comes to the subject of dosing, many people get overwhelmed with that as well. You'll read terms like irradiance, fluence, power density, joules per square centimeter, and before long, you'll feel like you're back in physics class. So let me simplify that idea. The useful dose is determined by the amount of light that reaches the tissue over a given time. That means the device strength, the distance from the tissue, and the session duration all matter. If your device is weaker, your session may need to be longer. If your device is more powerful, the session can be shorter. If you move farther away from the device, the amount of useful energy reaching the tissues decreases as well. So for that reason, it's important to follow the manufacturer's recommendations for your specific device and application. For most listeners, the safest and wisest rule is this: start low, keep sessions short, and be consistent 2 to 3 times per week. Do not begin with the maximum possible exposure just because you're eager and emotionally committed to glowing your way into transformation by tomorrow. That's not wise self-discipline. That's impatience wearing a wellness costume. Instead, begin conservatively and assess your tolerance. For many home users, shorter sessions a few times per week are a reasonable starting point, depending on the device and the application. Then you can observe, how does your skin respond? How does your tissue respond? How does the treatment site look later that day and the next day? The right response to a new tool is thoughtful observation, which brings us to one of the most important parts of our reset: safety. We already answered how to use red light therapy and the indications, but we must also delineate when not to use it. Those are called the contraindications. First, active cancer near the treatment area is a major contraindication. If you have an active malignancy, do not apply red or near-infrared light to that region, as it can increase cellular energy production, making things worse. Use in the setting of malignancy requires physician-directed intervention, period. Second, pregnancy. In general, it's wise to avoid applying red light therapy over the abdomen, pelvis, or low back during pregnancy, because we do not have adequate safety data for fetal exposure in that context. That does not mean every red light exposure is dangerous. It just means that prudence, judgment, and wisdom matter in this context. Third, hyperthyroidism. This is a big one because people confuse thyroid conditions. Some hypothyroid conditions are being studied as potential applications of photobiomodulation. But hyperthyroidism is different. If your thyroid is already overactive, hyperthyroidism, do not accelerate thyroid hormone production with light energy. Fourth, photosensitizing medications and medical conditions. Some conditions, such as porphyria, certain antibiotics like tetracyclines, acne medicines, some psychiatric medications, certain diuretics, and other compounds can increase your body's light sensitivity. If you're on medications, especially if the list is long or your condition's complex, ask your physician or your pharmacist before you begin, just to ensure that red light treatment is safe for you. Fifth, eye safety. Protect your eyes. Do not look directly into a red light device. Use eye protection when appropriate if treating the face, and do not assume facial use means eye-safe use. And again, never allow children to play with a red light device for the same reason. Finally, open wounds, burns, or infected tissue. Now, this area requires physician-directed judgment. Some wound settings may benefit from photobiomodulation, but they require physician-led wound care rather than self-directed experimentation. Now that you know the do's and don'ts, let's discuss a practical protocol. I have provided for you today my personal device recommendations in a downloadable document which is attached to today's show notes. If you choose to learn what I use and what I recommend, as well as any product discount codes I have to offer, they're available there as well. So, how do you start home red light therapy wisely? First, complete your research. Select your device and read the manufacturer's instructions that come with it. Next, choose one target. Not 6, just one target, and follow the device manufacturer's instructions carefully for that target and use. I know that sounds boring, but friend, a great many health mistakes happen because people assume that the instructions are for lesser mortals. Before you begin, take a baseline photo and keep treatment log with the date, time, treatment duration, and the site that you treated. That log's provided in those downloadable notes as well. If you're treating skin or hair, take clear photographs 2 weeks apart in the same lighting. If it's for pain, use a simple 0 to 10 pain scale to rate yourself before and after each treatment. If it's post-workout soreness, note the changes in how sore you feel and the duration of that soreness. When you begin, start with a conservative plan. For some applications, that may mean 2 to 3 sessions per week initially. For others, daily or near daily use may be suggested by a specific device and its protocol. The point is, there's no one universal rule here. Please begin with a structured plan and not just a random enthusiasm. Then, reassess your plan every 4 weeks. This is important because notable change often takes time. Many people quit too soon. Others continue indefinitely without ever honestly assessing whether anything useful is happening. You need a checkpoint, something to evaluate your progress. If you have no appreciable benefit after a reasonable trial with good adherence, one of several things may be true. The protocol may be wrong for you, the device may be inadequate, the condition may not be a good match, or you may simply not be responding in a meaningful way. Finally, have realistic expectations. For skin improvement, you may need 4 weeks to notice. For hair changes, you may need several months. For pain, you may notice some improvement early, but that typically improves even more over time. For muscle recovery, the effects may be more immediate, especially in your soreness patterns, but even there, consistency helps. This is why it's necessary to track something objective, like photos, pain scale, hair density, performance recovery notes. Do not trust vague impressions based on your memory alone. Interestingly, I found in my practice of medicine over the decades that the patient who says, "I don't think your treatment helped much," is the same person who also says, "I can't remember how often I even used it." Track your treatment and progress. That's wise stewardship. Another question. Can you overdo red light therapy? Answer, yes. And you can experience side effects with overuse. Think sunshine and sunburn. Persistent redness, tender skin, worsening discomfort, eye irritation, unexpected fatigue after sessions, or paradoxical worsening of the issue that you're treating. These are all clues of excessive exposure. Again, more is not always better. Sometimes the smartest adjustment is not adding time, but reducing it if you're overzealous. Ask yourself meaningful questions. Refuse to believe marketing hype, and seek counsel when you're unsure of your next step. Proverbs repeatedly honors prudence, restraint, and thoughtful steps. And in a marketplace built on impulse, that kind of biblical decision-making is a gift of grace. So before we close, let me give you a practical assignment. If you're considering red light therapy, write down the following. What is my actual target problem? What kind of device best fits that goal? What safety issues should I check first? What will I use as my baseline measurement? And how long will I trial this treatment before reassessing? That simple exercise will help many avoid wasting money or making emotional decisions in an unfamiliar technical field. As James 1:5 says, "If any of you lacks wisdom, let him ask God, who gives generously to all without reproach, and it will be given to him." Almighty God is not a vending machine. You cannot put your prayers in and push a button and get what you want. But He does invite you to abide with Him. Ask Him for wisdom and for discernment before you buy. Ask Him for patience and perseverance before you use. And ask Him for humility if this is not the right tool for you. Let me give you a very simple reset framework, which you can download from today's show. Choose one goal, identify one device, select one protocol, prepare one treatment log. That's enough to begin. You don't need to master the entire field of photobiomodulation. You do not need to become the neighborhood expert. You simply need to wisely take one clear step forward. Next time on our Renew episode, we'll bring all of this together. We'll discuss how to build a realistic, sustainable red light therapy plan focused on common goals such as skin, pain care, hair, and tissue recovery. I'll provide my recommendations so that you can integrate it into your healthy lifestyle rather than treat it like a glowing idol in the corner of your bedroom. Well, friend, thank you for joining me on the Aslan Health Podcast. Please subscribe and follow for more. May the Lord grant you wisdom in your decisions, steadfastness as He lights your steps, and peace as you learn to care for your body, which is the place where He now dwells. Blessings to you, my friend. Until next time.